Welcome to the Innovation Accelerator podcast, brought to you by Innovaccer, the health cloud company. We're on a mission to connect and curate the world's healthcare information to make it accessible and useful. With Innovaccer, everyone works in the service of patients like never before as one. Visit us online at innovaccer.com.
Hello, everyone. Welcome back to another episode of the Innovation Accelerator podcast. I am Charu Madan, and I'm the Vice President of Partnerships and Alliances at Innovaccer. Today, I'm delighted to be joined by Jallel Harrati, Senior Vice President of Sales and Marketing at Suki. Jallel, welcome. Tell us a little bit about your career journey, what you've gone through, and what brought you here.
Thanks, Charu. It's a pleasure to be here with you. Healthcare career from the beginning is the good fortune that I've had. I actually started my career working for a startup out of the Bay Area over 20 years ago in medical imaging. And that career took me to, quite a journey working for larger corporations along the way. And ended up here at Suki 2.5 years ago simply because I could not resist the temptation to join a company that was dedicated to address, I think, a burning need, which is tackle the burden of clinical documentation that physicians face. And also, I wanted to regain that energy that only a startup can bring to the table.
Wow, that's an exciting background. So basically, you had the startup itch and you had to come back to an exciting company. So that's great. And talking about exciting startups, Suki is an exciting startup. So maybe talk to us a little bit about Suki's background and history. What makes your technology unique and differentiated, and a little bit about, the value that you're adding in the market.
Certainly, Charu. Suki is a healthcare technology platform that aims to bring some of the latest techniques in AI, but also the power of voice to help physicians tackle some of the tasks that are taking away some of their joy of practicing, clinical documentation, and many others. So that's a little bit about Suki. The history is fascinating. We're about to turn 5 years old. The company was founded by our CEO and founder, Puneet Soni. He knew nothing about healthcare before venturing in this space, but knew a lot about consumer experiences. He spent time at Google leading a variety of different teams responsible for many of the apps that we have today in our smartphone, but also at Flipkart. And when he decided to perhaps consider new horizons, he shadowed physicians and was struck by the amount of time they were spending documented. And that's what led him to start Suki. To that end, we're very proud of the compelling vision that we have for the company, which is to make healthcare technology invisible and assisted so that physicians, clinicians in general, can take care of their patients. And that's what drives all of us here at Suki. We often say that every pixel in our application is at the service of doctors. And we fundamentally believe that. Charu, to achieve this vision, we have essentially developed a speech platform. And that speech platform is represented by our flagship product called Suki Assistant. And if we think about assistants, right, many of us are using a number of them today in our day-to-day life. The idea is to make it affordable, scalable, so that physicians can use their existing infrastructure, whether it's their mobile phone or their computer, to tackle a number of tasks. Scalability and affordability were the two key prerequisites of the company when we built the assistant. Think of it of almost a Siri, but tuned for healthcare, because we need to, as a voice company, be able to understand all of the different terminologies that physicians use. So we've invested heavily in natural language processing and understanding machine learning to help doctors complete administrative tasks by speaking naturally, just like we do with assistants in our day-to-day life. One of the key advantages of Suki is that we have the ability of exchanging information with electronic medical records in real time to provide that rich experience that a physician like. And I'll go through the list of some of the key and unique differentiators, if that's okay. The multitude of platforms that physicians can use Suki Assistant on, which was unique, right? Before, when it came down to clinical documentation, the physicians had to use a point-and-click solution within the EMR. Now, with Suki Assistant, they can use an app on their smartphone, on the web, or even on a Windows machine. It gives them really great flexibility because we actually have physicians creating clinical documentation on the go, in their cars, at their kids' soccer game. It opens up a new world of opportunities. It has to be easy to use, right? How often have we heard physicians talk about applications that take hours to learn? And with Suki Assistant, we really focused on that consumer-grade experience. It takes less than 45 minutes to onboard a physician for them to start using the application. And last but not least, we know that in healthcare, having a strong ROI is fundamental, right? Physician happiness is wonderful, but we need to focus on also improving the margins and the bottom line of these health systems and private practices. And time saved as a result of using Suki Assistant can correlate to a better quality of life, but also seeing more patients. And we have seen an increase in throughput by around 12%. That's 1 or 2 patients a day that can be seen as a result of using Suki Assistant. And then we've also invested in additional capabilities around coding to provide a stronger ROI for our users.
Wow. That's great to hear about your journey and all the impact you're making to really reduce physician fatigue. I mean, that's a real problem today, Jallel. As you know, we've talked about it in our conversations. So you guys doing a tremendous amount of advancement to help with that, to help with nurse fatigue and physician fatigue, I think will go a long way. And I'll actually talk about 2 things where which really resonated with me in your discussion. The first thing you mentioned, Suki was founded by Puneet, who actually did not come from a healthcare background. So I'll say this, that just like you said, healthcare can get all the help it needs. I also feel healthcare can get all the outsider help. We need people from the outside. We need outsiders because in some ways, healthcare has been, I would say, in some ways, dark ages of technology where other verticals like financial services and banking have just made such tremendous progress, which we see in our day-to-day life. And we don't see that translate in the world of healthcare. So I would say kudos for an outsider to come in and solve this problem. And the second thing I'll talk about is this concept of making it easy, making it takes 35 or 45 minutes, like you said, for a physician to get started. I mean, that is tremendous because we don't want to bog them down with technology and new things they have to learn. So the more experiences like a mobile app and getting up and running, what the things we see in our daily life, if that can be translated in their professional lives for these doctors and physicians, it's a game changer. So kudos for you guys for doing that, Jallel.
Oh, thanks, Charu.
Yeah, and that takes me right into the next question. And, you've answered bits of it, but would love to understand a typical customer profile for your, for your product and solutions. Large organizations, small organizations. Help us understand that a little bit more, Jallel.
Absolutely. Great question. But I'll make one additional point to your comment around healthcare getting help from outsiders and folks who don't have healthcare experience. They need to be patient because nothing happens overnight in healthcare, as you know. Okay.
And you said that with no pun intended. You've got to be patient. Yes, indeed.
Exactly. So I think you've asked a good question. Who is a customer of Suki? And I think I would break it down in two kind of customers. We have customers for Suki Assistant, the app that physicians, clinicians use. And we have customers of our speech platform. For Suki Assistant, the burden of clinical documentation impacts most clinicians. I have yet to meet a clinician who has not complained about the amount of time he or she spends in the EHR, tackling a number of tasks and taking that work with them at home, which is a big problem. So today we have tackled over 30 different specialties across a wide range of settings, from individual doctors to large health systems. Most of these users have tried other options available to them, point and click dictation solutions that are often not very accurate and do not adapt to the user's scribes, and even ambient solutions. And the problem with these last two options is that they're expensive. So it's really hard to afford these solutions, and it's hard to scale them in the large organization. The other interesting point I'd like to mention is that in some case, Suki is actually used not just to improve physician happiness, but with the retention and recruitment of new physicians, which is a problem today in healthcare. And reducing burnout and promoting physician happiness by adopting cutting-edge technology is a great way to demonstrate that there is a genuine desire in the well-being of physicians. And then lastly, again, I'll go back to the ROI because the financial side of the equation matters. And opting for a solution like Suki Assistant is often an argument that is well received by stakeholders that care about this specific element of our value proposition. So that's for Suki Speech, that is for Suki Assistant. For Suki Speech Platform clients, we have healthcare technology companies as clients, which is pretty unique, and that's one of the many twists and turns of a startup, right? You don't expect what you will be encountering. We actually did not expect to launch the underpinnings of Suki Assistant as a product, Suki Speech Platform. But today we're being approached by many healthcare technology companies who want to use the power of voice and AI to provide their own experience and better experience to their users. So you can think of an EMR company, a clinical communication company. There are many use cases where using the power of voice coupled with, again, the latest techniques in AI can make a huge difference for the patient and for the clinicians.
Yeah, that's very, very enlightening, Jallel. And that actually takes me very naturally into the next question as to what are some of the challenges you are seeing in the world of healthcare? And tied to that, challenges present opportunities. So tell us a little bit about the silver lining of opportunities that you see presented to you.
Yeah, healthcare, again, needs a lot of help, right? and from our perspective, we're trying to do what we can to help the clinicians by giving them access to a technology that will, in my opinion, give them back the most precious thing that they have, which is the time in their day. And some of the joy associated with spending more time with your loved ones or taking better care of your patients, which is what they signed up to do in the first place. And I would say that the pandemic has only exacerbated the trend that existed well before then. Physicians burning out, clinicians burning out. I tell this story at every occasion that I have. I've never received a hug from a doctor until I did a demo of Suki. And it's a true story. And I was lucky to experience this early in my journey here at Suki. I met this family doctor, and I did a demo, and she started to cry and confessed that as a mother, she was actually struggling with the fact that she did not have the time to spend with her family because of the amount of work she had to take home. She had to stay at the hospital for long hours. And then at the same time, she was failing her patients because of the lack of time she could not dedicate to them and the personal care that she could not give them.
Yeah.
So that stayed with me, and it gave me that burst of energy. And when I sometimes do not have it, when I wake up in the morning, I think of that story and I feel energized to keep pushing. And then in terms of the silver lining, Charu, if you look around, it's always there, right? Sometimes you have to look harder, but it's always there. But I do think that one that I see emerging out of this pandemic is that ultimately COVID may have been the biggest change agent in healthcare in terms of accelerating innovations that are required to make a meaningful impact for healthcare in general, but I would say more importantly, the frontline workers. And I want to remain optimistic that this acceleration will not fade.
Yes. And yeah, talking about silver linings, Jallel, I like you said it, COVID has been the change agent. COVID has been that catalyst for healthcare to adopt technology better and faster than ever before.
Right.
So in some ways, COVID itself, turns out to be the silver lining in spite of all the dark moments we've all gone through, the entire world. Yes, it has been a catalyst, a change agent. So really, really well said about that. That's a very heartwarming story. You have shared that story once with me in the past, and it touched my heart, and it's touched my heart one more time. So it's great when you see that kind of an emotion from your customers and how you can impact their life. It is just like you said, it gets you excited waking up every morning and being on your mission to transform healthcare. So let's get to the next discussion topic, and this one is very close to my heart. So let's have this more as a dialogue. But I would love to understand, what are the macro trends that you are seeing in healthcare? So talk to us a little bit about that, because you'll find that we as Innovaccer probably see the same macro trends, and we are in it together. So would love to hear from your vantage point.
Yes, certainly, sure. And I'd love to also get your take on the same question you're asking me. There are many, I think, trends that are emerging, and some that are being reinforced, right? Patient engagement is one of them. Population health management, understanding the needs of our population, of our communities even more, and being closer to them. Interoperability, finally, is getting the attention that it deserves. There's still a lot of work that remains to be done for making healthcare a lot more interoperable. Moving to the cloud, right? I think there is less fear and apprehensions related to doing that by health systems. And you're right, we've lagged behind many other verticals. And I, again, remain optimistic about some of these new trends and other trends that are resurfacing nowadays.
Yeah, Jallel, no, spot on. What you talked about, interoperability, moving to the cloud, the fact about population health, those are absolutely things that we are laser focused on. I mean, that's what Innovaccer wants to be. We want to be that platform that unlocks all those silos, unlocks all that data which was sitting in, different compartments, different small silos walled from each other. And to be honest, there is a reason for it. When there is privacy and health, your personal healthcare data is concerned. Yes, we all understand that there needs to be compliance and rules and governance. But at the same time, that being taken to the extreme, really, as a patient, as a human being, as a mom of kids, it does cause impediments, and it does not create that seamless experience. Like I was saying, what I see in my world of, if I'm banking or I'm trying to shop, in the world of retail, all the transformation that we've seen in our lifetimes, I think until COVID hit us, we've not seen that. So we are very passionate about interoperability. Having innovative companies like Suki build exciting applications on our on our platform that can really transform healthcare. So that trend is very near and dear to us. Even cloud, it's cloud seems like a vague and a fluffy topic, but at the same time, I would say cloud unlocks things that architecturals and a modern way of managing data that was never possible before, and at cost and efficiencies that was just not possible in the past. So that is also another enabler and a key theme for us. And I think both our companies, Jallel, you'll agree with me, we are cloud native. We are born in the world of cloud. So we were not the companies which were in an older architecture and everything had to be lifted and shifted. So I actually see that as an advantage and an accelerator, and actually why we are so compatible, and our DNAs, our values, our ability to be nimble and to be fast and nimble is what brought us also closer together as partners.
So, totally agree with you, Charu. You said it well. I think we have the advantage of being perhaps a bit late to the party, but we have an opportunity to learn from the mistakes and the shortcomings of other companies in this space, but also take advantage of the technologies that are now available to companies like us to enrich the experience that we bring forth for our users.
Yep. Better to be late to the party than not show up at the party. So I'm glad that we showed up to the party.
I think we're starting our own party now.
Yes, absolutely. So Jallel, I guess that's a logical segue and inroad into the next question. So we are partners. You're part of our ecosystem program. Would love to hear your thoughts about why you chose that. How does it help you and your customers specifically?
Yeah, happy to do that. Three things that jump at me, Charu, about the why behind our partnership and leveraging your ecosystem. One, you've mentioned that, is the fact that you've been able to build an interoperable platform. And the data platform that Innovaccer has built is something that we're very bullish about. Being able to extract valuable information and presenting it at the point of patient care in a meaningful way, in a concise way, is very important, and something that we know physicians want, desire, and that can lead to better outcome, which is great. One example could be pulling HCC coding capabilities and presenting care gaps, leveraging the Innovaccer platform. So that would be point number one that I'll make. Point number two is InNote, leveraging the fact that you're creating a great application that physicians are leveraging to make cost and quality related decision that can yield to better outcomes. So if you take InNote and you couple that with Suki Assistant, which helps physicians tackle clinical documentation, make them more efficient, well, you've built really an application and built on a platform that can bring significant efficiencies to physicians, and that has obviously a lot of great ramifications. And then finally, which is important, I do believe that beyond the product and go-to-market synergies, we value the relationship we have forged with you, Charu, and the team at Innovaccer. You're right that the culture and the value and aligning around these two fundamental elements is very important when it comes to executing a sound strategy.
Yeah, well said, and goes back to our alignment along our thought processes, our DNA, our value system. So that's great as the companies. So moving on to the last question, Jallel, for the day. If you could change one thing in healthcare, just one thing, what would that be?
That's an interesting question. So many things that I would want to do, but I'm going to focus on one thing, Charu. And I would say I would continue to improve the interoperability and exchange of data. It is wonderful to see companies like Innovaccer and Suki do their part, but there's still more work that needs to be done to free the data. Right? And I'll say it again, free the data that is trapped in these archaic systems and stop the monolithic view of the data that we continue to endure. And I think that's been preventing innovations in this space and companies like us to truly make it easy for clinicians to provide better outcomes, to provide better care ultimately, and do all of this at a lower cost.
Jallel, it's been a privilege and pleasure to speak with you today. And we are very excited at Innovaccer and this great partnership with Suki. So let's speak again soon. And thank you for being here. For our listeners, don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned to the Innovaccer podcast for more shows covering the healthcare IT topics that you care about. For more information on our industry-leading partnerships and offerings, please visit www.innovaccer.com. Thank you again, and I'm Charu Madan, and have a great rest of your day.
You've been listening to the Innovation Accelerator podcast, brought to you by Innovaccer, the health cloud company. Don't forget to check the show notes for links to related resources and other information. And stay tuned to the Innovation Accelerator podcast for more programs about the healthcare IT topics you care about. Accelerate your transformation and build the future of health on the Innovaccer Health Cloud. For more information, please visit innovaccer.com.